Hello and welcome. You're watching Medically Speaking, and I'm Vaishali Sharma. With me, Dr. Suman Lal, Associate Director Gynecology, Max Gurgaon. Welcome, ma'am.
Thank you.
In
Yeah,
the last video, we discussed about various topics regarding sexual health, including menstrual health and STDs. Ma'am, vaginal health is a very important part of a woman's health. Abnormal discharge, bumps, boils, vaginal odor are very common issues. So, what are the ways to maintain proper vaginal hygiene?
it is important to maintain the private part area healthy. And just I will say a few do's and don'ts. When we talk about the don't do, what is this? Basically, we should not apply any moisturizer or any other Savlon, betadine to clean the vaginal area because it can cause decrease in the safe bacteria which are present in the vagina. The second thing, some women are doing lots of jet watering to clean the vagina. That is not good because jet water can increase the infections which are in the lower part. It can go to the upper part and can cause more infections in the inner part of the body. And sometimes the people are doing the douching with the some betadine or some sort of antiseptic. That is not also good. When we talk about the do's, means what to be done, is important to keep the area dry, healthy. Wear the cotton UZ, that is important because it will give you, your area will breathe, cells will breathe with time. So that is very important to use the, not the tight UZs, you wear the cotton and loose fitting things in the inner part and change the usage at least 2 times a day. That is very important. And when the woman is having the discharge or the foul smell, or sometimes they are having more urinary leak, better to contact with the gynec and get it treated in the early stage because sometimes these are the infections. Sometimes it are the indications of some internal cancer, especially cervical cancer. Sometimes some women are having polyp and fibroid, and they can present with all these symptoms. It is important to get treated in time.
Ma'am, can antidepressants induce sexual dysfunction in females? Because these days we have seen a lot of use of antidepressants among teenagers, among youngsters, especially from the age of 15 to 25 and 30.
Yeah. Basically, if any woman or any girl is suffering from the depression, or even if a male is suffering from the depression, the sexual desire goes down and libido is decreased on those. So it is some psychological and some physical causes also, which the depression can cause the decreased libido, decreased erections, and in the female, decreased desire to go for sex. When they are taking antidepressant, because these are the drugs which causes effect on the brain, from where the sex desire comes in the female, that also affect the sexual desire for the female, and they are having, yes, the decreased sexual desire or decreased libido. Sometimes it happens that they are having the severe depression. If they are okay with the, after taking the antidepressant, we can have the better outcome in the sex problem. It is depends on the what problem they have. But if the woman doesn't have the sexual problem and they are taking the antidepressant, they can have the decreased desire for the sex. Yes.
Rightly said, ma'am. Loss of libido is a common problem that affects men and women at some point in their life, and it becomes a cause of many distorted relationships. So, what are the physical factors other than the antidepressants that cause this, and how can this be cured?
Yeah. When we talk about the routine body, the woman who is pregnant, the woman who is lactating the mother, baby, and the woman who is having menopause, there the estrogens are less, and therefore sexual desire goes down. That is the normal in the woman in those times. But sometimes the bad past experience that also causes the decreased desire. We have seen so many times the girls who are having the decreased desire because they have the vulvodynia, means They have the contractions of the vaginal muscles when they go for intercourse, and therefore they feel severe pain and they don't want to go for intercourse. In that cases, we do Botox treatment and we do some treatment, some psychological treatment, and they come out with a good outcome. Sometimes the women are having some vaginal infections, which is recurrent, and therefore when they go for intercourse, there's some sensitivity and burning sensation, and therefore they don't want to go for sexual intercourse. That is also treatable. Laser therapy is also coming up very well in those women. We can use the vaginal rejuvenations with the laser therapy, and infections also goes down, and therefore sexual desire can come. Sometimes the women they are not having stimulations in G area, G spot area, which is theoretically, it is now known for the sexual stimulation. In that cases also, we can go for the G spot augmentations using the feelers, using the PRP, and that also can be treated. But therefore, it's important not to go for the causes. We should know the treatment plan so that we can go to the doctor rather than feeling the depressed, I'm not having good desire. Sometimes the girls are having the lots of secretions, like the routine secretions, and that can also make them, okay, I don't go for this sexual intercourse because I have lots of secretion. That is mostly because of the more mucus is secreting because of the some infections that also can be treated in those women. In the postmenopausal women, there's estrogen deficiency, thinning of the vaginal area and outer area that causes lots of pain, and their skin is not very healthy in that area and they don't want to go for sex. In those cases also, we are going for the laser therapy and PRP nowadays, and that is giving very good result. And I think there are lots of physical factors rather than psychological factor which causes these problems. And these problems can be treated. Better to visit to gynecologists, discuss your problem so that you can be treated in time.
Right, ma'am. One more question now, coming to a very pertinent issue, PCOS, that is PCOS.
Yeah.
As per recent data, reported by the ICMR, Kashmiri women have the highest prevalence of PCOS globally. According to the Rotterdam criteria, Kashmiri women have 33.3% of it and 28.9% as per the national health criteria. So what are the causes of such high incidences of PCOS and what are the treatments available for this?
When we talk about the PCOS, I think without PCOS, where gynae problem is not to be discussed nowadays. It's so common. When we talk about the PCOS is the hormonal imbalance in a woman. It can occur either at the young age, it can occur at the age of 30,
Yes.
It can occur at the age of 40, any time.
Yes, ma'am, because some of my friends are as well suffering from the same disease, and irrational gain of weight have been noticed in them. So what exactly?
When we talk about why the PCOS incidence is increasing now,
yes.
Previously, when we talk about you can understand when we talk about the diabetes. Previously, people didn't have much to eat. Diabetes was not common in our country. But now the people are going for the sedentary lifestyle, stressful life, lots of fat to eat, lots of sugary thing to eat, lots of refined food to eat, and they are going for more diabetic. And we are seeing that the 1 in 5 person will have the diabetes in future. Is the same. We have the genetic makeup of hormonal imbalance in our body. And some girls are having more genetic makeup, some are less. When the environment are not favorable, means they are having sedentary lifestyle, they are having more stressful life, eating habits are bad, no exercise, stressful life. In those cases, PCOS is coming in their body as such a disease. In fact, they are having the genetic makeup, but since the aggravating factors are those, therefore they have weight gain, they have abnormal cycle of the period, and they may have the hirsutism, like the hair excessive hairs on the face, chin, and over the body. They can have lots of pimples. And sometimes they have lot hypertension, diabetes, and other disease as well. So that is the PCOS. It can start from the simple hormonal imbalance in the body, and that can goes to the very bad, say, for the woman. When we talk about the treatment, if we go to the diabetes, because these are all are the hormone related.
Yes.
If the person is having diabetes, we can't just take out the diabetes from the body. What we say, go for exercise, eat less, go for the stress less exercise life, then
Right.
you will have less blood sugar. It's the same with the PCOS. We can't take out the PCOS hormonal imbalance from the body. What we say that go for exercise, go for at least food habits, proper food habits, and at the same time you can go for the stress-free exercise. So what we treat as a gynecologist, except the lifestyle modifications, we treat what the symptoms they have. If the woman is coming to us, they are having a period who is coming very late, means ovulation is not occurring in the body. In that cases, we go for treatment of the period. We give the hormones so that their period will be regular. Sometimes female are coming, they are not conceiving. We know that the ovulation are not perfect in the PCOS. We give the ovulation trigger so that ovulation will be there and they can conceive. Sometimes women are coming with the hirsutism, lots of hair growth. We give the medicine so that hair growth will be less. At the same time, we say that go for laser treatment for the hair, lots of hair. Sometimes female are coming with the acne. We treat the acne as well as we give the hormones so that hormonal imbalance will be less. But at all the time, we say that once we stop the treatment, you can have the same problem later on. Therefore, it is important for you to go for the lifestyle modification. If you are not going for the lifestyle modification, in the long run, you will have all the symptoms again. So therefore, again, I'll say most important is the lifestyle modification as a treatment. And there's no treatment available which will make woman who has PCOS and then she will not have PCOS. Maybe they will not have PCOS on the ultrasound because of the lifestyle modification, because of the hormonal medication. But once we just stop all these things, it can come again. Therefore, it is long-term, whole life modification is required rather than one-time modification is required.
Okay, so there's a long-term modification, ma'am, because as we say, precaution is better than cure. Ma'am, what are the safest methods of contraception for female? Like when they go for sex, what are the safest methods of contraception? Like when we hear about the contraception pills, it is heard that it affects the fertility of the woman, and when going with the IUDs, it affects the uterine lining of the woman. So what, according to you, is the safest method of contraception?
Very difficult to say which is safest. When we say that contraception is always the individualized, means the one person will get the benefit from one contraception, other person will be benefited from the other sort of contraception. Ideally speaking, if the couple are using male condom, where the male partner is using condom, is the safest method because it will not transmit the sperm to the female vagina. At the same time, it will not transmit any infection from the male partner to the female partner, so the infection will be less. Therefore, we always say if the couple can use the condom, that is the best and cheapest and safest method of the contraception. At the same time, it can prevent them from the STDs, sexually transmitted disease also.
Okay.
But not all the male partner use the contraception. Then onus comes on the female partner because anyway they are going to have the unwanted pregnancy and suffering from to them only. So therefore, we discuss about the one by one all these things. When we talk about the other contraceptive like pills, the pills has the good because it is 21 days one has to take the pills and 7 days pills free days will be there. In that time, one can have the period. Period can be little less, nothing to worry. But at the same time, if one person is not taking the pill at regular time, or sometimes they are leaving the pills, they can have the bleeding off and on. So therefore, if person is using pills, they have to take the pills at the same time, preferably after night meal. Because dinner time is more or less, it is same time. Therefore, we say that take the pills at the either sleeping time or at the after the dinner. These, what are the disadvantages if you are taking the pills? Pills are the hormones. The hormonal side effects are always there.
Right.
Can be like there's some women can't get the pills, like the woman who is having the history of some cancer, genital cancer, where we discuss with the woman, and the woman who is having gallbladder stone, lipid abnormalities. In that cases, we like, or the history of migraine, where we don't want to give the combined hormone pills. Some pills are coming in the market, like the progesterone, using only progesterone pills. They can be given to those women, but they can have the erratic bleeding in between. Therefore, each contraception has its own advantage and disadvantage, but the pills are the safest in this sense because they are efficacy is the very good. If the person is taking pills properly, and this practically there's no chance of the pregnancy. Now coming to IUCD. IUCD is sorry,
It's okay.
good contraception, and because the IUCD is inserted in the woman, it remains for 3 years, 5 years, 10 years, and once woman wants the pregnancy in between, IUCD can be pulled and it can be easily managed. Mostly IUCD will not affect anything. Generally, we say that IUCD should be given to the woman who has at least one baby, because the theoretical things is that IUCD can cause some infections and later on infertility. But it is not true. If there's IUCD and there's no infection, it will not travel up and it will not cause infertility. The women who can't take the OC pills or who can't manage the OC pills, is better to apply the IUCD in the center. It can be applied in any of the center, primary health center or anywhere, and only ANM is required to apply it. There's no need to go for the specialized doctor for its insertion, and it can be managed very well. And lots of millions of women in India are using IUCD, and they are really having good life and good spacing between the children.
Ma'am, you covered a variety of topics, and there are many topics to cover with the sexual and reproductive health of women, especially considering the physical aspects, considering the hormonal aspects, considering the cancer and everything. Ma'am, but since we are running short of time, what are the best sedentary lifestyle hacks that you would suggest for women to apply in their daily life, especially the working women, with their vaginal hygiene? Many girls, many women experience vaginal hygiene problems like dark intimate areas, bumps, as we discussed before, and sour breasts, irregular period cycles. So what are the life hacks that you prefer?
First thing is that don't let your weight to be increased. Most important in sedentary life, if you're working, then you make a choice in between, after 1 hour, you will move for 5 minutes in your working place. The second thing is that after lunch, you can just have a walk for 15 minutes. That every woman has the time in the working place. Right. The few things, the positional pain, like the women who are just sitting on the computer and working like that, they have the pain in the shoulder, they have pain in the back. So that they have to go for this exercise on their table only every half an hour. That's, I say, all pregnant women generally, I explained a few exercises that not the pregnant, all the women can do the exercises. Every day, 5 to 10 minutes, they can do some stretching exercises for themselves, because exercise is the most important thing. Now coming to food. What happened generally as a working woman, we don't take food for long hours. Means we remain fasting, we are busy in the work, then we feel hypoglycemic and we eat lots of carbohydrate and fat. So therefore, is always carry the some food which is protein food or the nutritious food, less calorie food with them, and they can use the food at least 2 to 3 hourly. They can have something to eat so that or something to drink like the healthy drink, and that can make them, they will not be so hypoglycemic and they will not eat some unnecessary food or unnecessary chocolates or unnecessary coffee, because in the working place most important weight gain is because of the coffee and because of the chocolates and because of the unhealthy food. But that if they are doing, that is good for them. The third thing is about the stress. When we say that working women carry the stress at home, and home is always the stressful time for them because they are having children, they are having the partner, or they have lots of parents, old parents, they have to take care. So this, they have to know that when they are working in the office, that's stop the stress there and then go home. That is the most important thing, because if they are carrying this stress at home and carrying the stress from home to working place, yes, naturally they will have the lots of stress related disease. Yes. And at the same time, because what you said about the darkening of the skin is generally a kind of private part because of using perfume, having lots of sweat, using
Yes.
powder in that sweat area rather than going for cleaning. So therefore, I said take a good bath morning and evening. They can use the lemon to clean the area rather than going for using perfume and powder, which will cause the darkening. If they have the infections, they can go for the pubic hair removal and axillary hair removal, because the lots of pubic hairs can also give the lots of infections. So that they can go for the laser therapy or they can go for the trimming, just cutting the hairs. That is very important for them. And if they are taking care of their private parts, just clean and they will not have much infections in that area.
Ma'am, a lot of questions are just popping into my head right now, but since we are running short of time, so
I think we can
we'll
keep
just,
later on.
yeah, we'll just wrap it over here. So I won't take much of your time. So thank you for such an important message, ma'am, and I hope it has been as edifying to our viewers as it has been to us. For now, I would like to thank you for your time, ma'am, and thank you
Thank
viewers
you.
for watching and joining us on this special day. Do visit our website medicallyspeaking.in and follow us on Instagram, Facebook, Koo, and Twitter. Thank you for watching.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.